Hey guys, it's Big Rob here. Just a guy over 50. Nobody's super important. Just a registered nurse out here traveling, working in the middle of this COVID-19 epidemic out here in Bethel, Alaska. Um, Been under quarantine now, essentially quarantine, for a couple of weeks. It's been pretty crazy. The hospital has been doing a really good job of dealing with this crisis and trying to get us information and PPE and those kinds of things. So I'm pretty happy about the way that's going. But I've heard some disturbing things from some nurse colleagues of mine that are around the country, and I just kind of wanted to maybe see if I should address this. It's been a while since I made a video, um, and most of my videos have been ranting about some politics and some other stuff, but this COVID-19 is this human coronavirus, novel coronavirus, whatever you want to call it, is a big deal. It's serious, and people are dying. Thousands of people are dying. People are getting infected every day, and we as Americans just don't seem to get the picture. We just don't seem to understand that the bullshit that's in our grocery carts is probably not worth our lives. I will tell you that the last time I was in Anchorage, I was at Fred Meyer. It's a grocery store chain, for those of you unfamiliar, that a number of older women were just pushing carts around like it was no big deal, coughing around other people who were coughing, who apparently did not look well, but yet out in public, handling things that the public handles. And not one time did I see any of these people going by with something that they could not live without, except toilet paper, apparently. So, anyway, I just want to impress upon you folks that this is serious. And I'm no expert in virology or epidemiology, but being a nurse who is in the emergency room and watching this transpire after 20 plus years of experience, I can tell you that it's a very serious thing. And it's not a conspiracy. This isn't some sort of, Trump organized attempt to reorganize the government. Although the Democrats sound like they want to use this as an opportunity to reorganize the government in their dream world that they imagine life should be. But it is a serious thing, and I want to impress upon folks that the nurses in this country seem to be taking the brunt of this punishment. And so what I think this exposes in our American healthcare system is a management system that suggests it's okay to run things at a crisis level on a regular basis. Not so much in my hospital. I feel like in my hospital, they're pretty generous with the resources and human resources as well as material resources. Do we have things that don't work? Of course we do. Do you have things that frustrate us? Of course we do. But we work around those kinds of things, and they're not really life-threatening. So, but in other hospitals, I hear that the managers are refusing to allow people to wear PPE. What kind of level of fucktardery is that with these patients? I just don't understand this. Well, why don't you have enough masks for your nurses? Why don't you have enough masks for your respiratory therapists? I mean, what is it you can possibly gain by withholding this kind of material, especially if it's available? I don't understand what you could possibly gain from this. To report back to your supervisors that you managed your PPE for the day and managed to, put people at risk for exposure to this deadly virus, you should be ashamed of yourselves. I don't know how you non-essential six-figure salary pieces of shit can go home and sleep at night knowing that this is going on in your hospitals. You people out in New York and Los Angeles and Seattle who are attempting to regulate how many masks a nurse can wear in a day, when before, the rule was you throw it away after every use in and out of a TB room, for example. Now, you want us to wear these N95 masks for days until they become soiled or start to smell or whatever your particular armchair statistic or tactic is going to be that day. It's appalling. It's disgusting. It represents a level of situational unawareness that is bordering on malice. And so, again, level 1 fucktardery. Congratulations. You have just declared that you're an idiot. So if you're one of these managers, you're one of these supervisors that's doing this, stop it. Stay home. And get out of our way. We're trying to take care of the country. We're trying to do the right thing. You're not. We are. We've taken the training. We understand how the risks. We go in and out of rooms with VRE and C. diff and MRSA on a daily basis. We don and we doff all the time, day after day after day, without your help, without your criticism, without you standing over our shoulders telling us how it should be done. Go back to driving your desk. Go back to sitting behind your computer and scanning through your spreadsheets and bullshitting, answering your phone, taking your 1-hour lunches. Go back to doing that. Having your meetings. Go back to doing that. But do it at home so you don't infect the rest of us with your non-hand washing, sneezing, coughing, fever-having asses. Okay? Why don't you do that for us? That's a favor that you can do. Get the fuck out of our way. Let us do our jobs. And on that note, I'm going to sign off. I'm just a guy over 50. Oh, one more thing. I've been traveling peer of mine who I met a number of years ago down in Texas. Super great gal, hardworking nurse that some of the nurses over in Rapid City in the regional hospital there were blaming this coronavirus on Trump. I was posted out of that hospital when H1N1 broke out into the country. Every room in the ICU had a patient on a ventilator for a variety of reasons, but a lot of it was H1N1. Elderly folks, a lot of Lakota, very sick people. A lot of these people live out on the Pine Ridge Reservation where there's very little in the way of running water, modern plumbing, dirt floors, things like that. Third world conditions. Shameful. The United States government should be ashamed of itself. But this goes on. And I never once heard anyone blaming H1N1 on Barack Hussein Obama and his administration, even though I'm pretty sure the CDC was in town and in the hospital every day trying to figure out exactly how this was working. Because so many people were getting so sick that we had to actually prone them on ventilators in their beds. For those of you who don't know what proning is, we actually flip the patient onto their stomach while they're on a ventilator. And it is not a benign exercise by any stretch of the imagination. These people are sick as fuck, and most of them will not survive. If that happens here with this virus, and that person is to be proned, they are very likely to pass away. And that's how serious it is. But the whole time I was there for about 5 or 6 months as a traveler. I never heard anybody blame the administration for this. I never heard anyone say anything like Barack Obama's administration doesn't have enough PPE. We don't have enough ventilators because of Barack Hussein Obama. We don't have enough ventilators, or we don't have enough medicines because of this or that. I would tell you that blaming the Trump administration for the spread of coronavirus and the fact that large hospital systems are mal-equipped to deal with that represents a level of stupidity that also borders on malice. If you're a nurse who's spreading these rumors and saying that it's Trump's fault, I think that you should clock out and go home, because you are so mentally incapacitated that you are unable to care for these patients in an unbiased way. You just simply lack the emotional, intellectual, and spiritual skill to do your job. And that's not an indictment of your intelligence, but merely stating a fact. If you believe, on the one hand, that Trump, the president, is responsible for the spread of the coronavirus, not the Chinese government, not the Chinese communists, not the wet markets where this bullshit comes from. If you think this is Trump's fault, you are so deranged that you should be considered mentally incapacitated. And you should relieve yourself of duty, go home, and find something else to do for a living. Just saying. We don't need that kind of thinking here. We need the kind of thinking that is rational. We need the kind of thinking that absorbs new information on a regular day, that is flexible, that is open to other ideas. You're playing politics with the lives of human beings, and you're a nurse. You have no business doing this. If you are doing it, shut the fuck up and go home. You don't belong here. You don't belong with us. For all the nurses that are holding it down, families at home, you're working 5, 6, 7, 12-hour shifts, 13-hour shifts, 14-hour shifts. Transport nurses, in and out of aircraft, ambulances moving these patients, paramedics, respiratory therapists, people that are on the front line. For the physicians that are trying their best to figure this out, good luck. God's with you. I'm with you. Your brothers and sisters are with you. In the end, we all know how this turns out. So long. I'm just a guy over 50.